Hi everyone, our project focuses on gender identity stress, specifically transgender identity stress. This is a group project by Ashley Martinez, Julia Dixon, Yesenia Popoca, Alyssa Vasquez, and Sabrina Bianco. Gender identity, as defined by the CDC, refers to one's own internal understanding of their own gender or the gender with which that person identifies. This is usually expressed and measured through clothing, appearance, and behaviors. Each society has a culture in which there are sets of expectations or rules regarding gender identity. A popular expectation regarding gender identity within our own society is that gender identity is simply binary, so either male or female. This is not true, and there are those who identify as non-binary. They can use labels such as genderqueer, gender variant, or gender fluid, meaning they can identify as one gender one day and a different gender the next. This information is provided by Planned Parenthood. Gender identity stress usually results from an individual identifying as a gender that is not consistent with the way they're perceived by society, or them identifying as a gender that is not quote-unquote real in our society. This includes transgender people, and APA.org defines transgender as an umbrella term that's used for people whose gender identity, gender expression, or behavior does not conform to that typically associated with the sex to which they were assigned at birth. So someone who was born a male, who later identifies as a female, acts and dresses as such. People who identify as transgender often express their identity visually, such as through clothing, behavior, and or sex-correcting surgery. Transgender individuals face a lot of prejudice, discrimination, and harassment because they are not highly accepted in society due to that popular expectation or belief that there are only two genders. A study conducted in 2015 on resilience and to minority stress that used a transgender sample found that transgender individuals who faced minority stressors due to them identifying as transgender. So this includes anti-transgender discrimination, stigma awareness, and internalized transphobia. The study found that they had greater levels of psychological distress, and this was measured through feelings of loneliness and self-blame. An unaccepting society can lead to high levels of this psychological distress and have other impacts on these individuals.
In connection to gender identity, and more specifically transgender, we wanted to look at the possible correlation and connection between transgender people and depression because of the much discrimination they face because of their gender identity. And that leads us to question, what is depression? And while according to the American Psychiatric Association, clinical depression, which is also known as a major depressive disorder, is a common and serious medical and mental illness that negatively affects how you feel, the way you think, and how you act. And an example could be a friend of yours suddenly doesn't want to do their favorite activity or favorite game of basketball, and they begin to have a more negative outlook on life and themselves. And this is a major symptom of depression and is something to look out for. How is depression measured? Well, there are many different ways, but a more structured way that many people use is the Beck Depression Inventory, and it is a list of 21 items that examines symptoms and attitudes, for example, mood, pessimism, self-dislike, suicidal thoughts, social withdrawal, and it asks the participants statements such as, I do not feel sad, to I am so sad, I am unhappy, and I can't stand it. And each of these rated statements allows us to determine in their intensity of depression. And as you can see, the more higher scoring, the more severity of the depression. And this can actually be administered by trained interviewers, but it can also be self-administered, which takes about 5 to 10 minutes. And another similar depression measurement is through the Center for Epidemiologic Studies of Depression Scale, and it measures the current level of depression symptoms and especially depressive affect. And it is also a self-report questionnaire, It features statements like "I felt lonely" and allows the participants to answer how often, which could be rarely, which is a day or less, or to almost always, which is 5 to 7 days a week. And the possible ranges of scores is 0 to 60, with the higher scores meaning the more severity of the depressive symptoms.
The biological pathway involved in the biopsychosocial model of stress focuses on the nature of how stress affects an individual. So, for gender identity leading to depression, one such biological mechanism could be gender dysmorphia and how that internally affects one's identity leading to depression. So, furthermore, there's been research that has been studied for this because it has not been pinpointed, but along with the research that has been done, many studies have focused on twins because you can identify or more easily identify genes and traits that are connected to such effects as depression or trans identity non-binary. So multiple studies have used that to find that there is a gender-related heritability for transgendered individuals. There's also been studies focused directly on gender dysmorphia, not traits, and found a strong heritability component of 62% in most studies. When looking at genes, not only phenotypes, but genotypes, there's been studies focused on the sex hormone related genes and found for female to male transgender individuals, there's been an increased prevalence of the A2 allele on the CYP17 polymorphism gene. This is important with steroid hormones, but this was not seen in male to female individuals, so this could not go across all transgendered individuals or gender nonconforming individuals. Other studies have focused on androgen receptors, and loss of functions there can show a resulting effect of males exhibiting more female gender identity. Within this, there had been increased numbers of trinucleotide CAG repetition. You can see in the top right picture from normal to where there would be multiple repeatings of the CAG. This was only seen in male to female individuals, though. Furthermore, in that study, there's also been a flip where you would see less CAG, but there'd be repeating numbers of ERB receptors, and this was seen in male to females, not in, females to males, not in male to female individuals. So that would show a decrease in feminization in females. Furthermore, there's been research that's focused on the biological pathway and how it directly affects stigmas, especially in the medical field, as well as in society. So researchers continue to prove that gender identity in any form, as you can see here, is innate biological and not a choice and can't be discriminated against in such a way. So researchers continue to integrate a human rights framework and a biological framework to lessen stigma, because lots of businesses in the medical world focus on human rights, that all people are equal, but that doesn't necessarily work for everyone to agree on that, unfortunately. So we need to do more research in understanding the biological way that this is formed, so we can just prove through science that this isn't just a choice. So for the general public, studies have shown that easier and informative access to genetics for obesity has created a safer space for individuals to become healthy, and that can roll over into understanding more biological measures, even for gender replacing obesity could help. For medical professionals, research has shown that increased understanding of the potential and already understood genetic knowledge of gender identity has reduced the negative stereotyping and stigma in the medical field. So even with those learning about all these biological factors, even knowing more about an individual's identity will help them be able to treat them in a non-judgmental, non-biased way.
The second part of the biopsychosocial model is the psychological pathway. According to our textbook, the psychological model focuses on how psychological behaviors such as thoughts and feelings underlie health. Some of these factors can include self-esteem, mental health, and coping skills. The study Collective Self-Esteem as a Coping Resource for Male to Female Transsexuals does a good job of introducing the psychological distress that transgender individuals have dealt with that has led to depression. The study found that the fear of how a transsexual identity would affect one's life was the best predictor of the severity of psychological distress. Some of the fears that were common among transgender individuals included losing a job, fear of losing a significant relationship, and fear of being victimized in public. Overall, the participants' fear of being discriminated against because of their gender identity caused them psychological distress, which then resulted in depression. The third and final part of the biopsychosocial model is the social pathway. The social pathway focuses on ways in which society and culture influences health. Some of these factors include peers, family circumstances, school, and socioeconomics. The study I chose to talk about is social support, exposure to violence and transphobia, and correlation of depression among male to female transgender women with a history of sex work. This study looked at different ethnic and racial groups of transgender women who are sex workers. The participants were asked on several 5-point scales, 1 being never and 5 being almost daily, about the frequency they had been receiving social support from family and friends over the last 30 days, as well as if the social support they were receiving was satisfactory. The study found that depressive symptoms were significantly correlated with the exposure to transphobia, higher needs for and dissatisfaction with social support, and lower levels of receiving social support. The lack of social support came mostly from the participants' family members who were unsupportive of their transition. Over half the participants reported that their biological family members would physically assault them, as well as ridicule them or embarrass them for being transgender. Other lack of support came from friends and community members. Overall, the study showed that having a lack of social support caused depression in the participants.
Gender identity intervention. This intervention was done by David Brookman and Joshua Kalla. They're from the American Association for the Advancement of Science. So it started with the conversation. They elected canvassers to knock door to door on registered voters' homes unannounced. They came unannounced to avoid any kind of prejudice action between the registered voters. They found in other studies that when there was an announcement made that they were coming, they already had biases on what they were going to say, so they did this unannounced to do prejudice reduction. So the canvassers defined the term transgender to the registered voters and then asked them if they could think of a time when they experienced any sort of sadness or confusedness for being different. And they asked the registered voters if they could use that experience to try to familiarize with how transgender people feel being different in an environment all the time. So of those registered voters, 1,825 were randomly selected to further the intervention with a survey. And the survey was split into 2 different groups: people targeted with intervention, about 900 people, and people targeted with recycling to skew any suspicions of the intervention. This was also about 900 people. So to test if this 10-minute conversation that they had about the analogic experience to try to familiarize with transgender people, they gave the survey people a anti-transgender attack ad. And after viewing the ad, they gave this ad to both groups, the recycling and the intervention study. Both groups were less supportive of transgender people. So after seeing the attack ad, they supported discrimination laws. They didn't support discrimination laws, and they just had an overall bad connotation of transgender people. However, the intervention group was more supportive of trans people than the placebo group displayed. So even though they were all less supportive, the intervention group actually did show a bit more support. And they went back to test these same survey people, and they noticed that subjects that were exposed to the ad expressed different beliefs after 3 months. So they went back to their attitudes of supporting transgender people and laws. They completely dismissed that sort of bad connotation that they got from the ad. This was to show that the 10-minute conversation holds more merit, and it actually can change the individual's minds. The results were that the 10-minute conversation, just talking about similar experiences and getting to know what it is that transgender people are, what they're about, what they experience, and familiarizing their own experiences can change an individual's mind. So commonalities were a result of this survey as well. And this is important for the future, as this intervention expresses how discrimination can be defeated with just conversation and understanding. It's important to further this research, to just talk to one another and familiarize with each other's experiences, even when there's things like attack ads or other conversations, or maybe somebody says something that will be in support of what they think for discrimination. It can still be changed with experience and conversation. I think that's a very important aspect to the intervention.
Lastly, here are all our references that we used throughout this slideshow.